welcome to the channel. Today we're diving into an essential topic for your physical, emotional, and sexual well-being, what you should do before and after sex. Whether you're new to intimacy or just looking to improve, this one's for you. Sex isn't just about pleasure, it's also about safety, communication, hygiene, and connection. Whether it's your first time or your 100th, preparing before sex and taking proper steps after can drastically improve your experience and overall health. Many people overlook these steps and face issues like discomfort, infections, emotional disconnect, or even regret. In this video, we'll walk you through everything you should do before and after sex, from emotional readiness and communication to hygiene and post-care. This guide is suitable for everyone, singles, couples, and anyone exploring intimacy responsibly. Remember, being sexually active means being sexually informed. So, let's break the taboo, stay educated, and prioritize our well-being before diving between the sheets. Let's begin. Before sex, segments 1 to 10. 1. Check your emotional readiness. Before sex, take a moment to assess how you feel emotionally. Are you doing it because you want to? Or is it due to pressure, loneliness, or trying to keep someone interested? Emotional readiness ensures that sex is consensual, positive, and fulfilling. If you feel anxious, unsure, or emotionally disconnected, it's okay to step back. Clear your thoughts, understand your intentions, and remember, it's your body, your choice. A healthy sexual experience starts with being emotionally grounded. Never underestimate the power of self-awareness. Open communication with your partner about how you feel emotionally can also strengthen intimacy and help avoid misunderstandings or hurt feelings later. Always check in with yourself first. Your mental and emotional well-being matter deeply. 2. Talk about consent. Consent is non-negotiable, always enthusiastic, clear, and continuous. Before any intimate activity, make sure both you and your partner explicitly agree to what's about to happen. That means asking, listening, and respecting boundaries. Silence is not consent. Coercion is not consent. Being under the influence of drugs or alcohol can impair someone's ability to consent. This discussion doesn't have to be awkward. In fact, it can be sexy. Saying, "I want to," or "Are you okay with this?" shows maturity and care. True intimacy thrives when both people feel respected and safe. Practicing consent isn't just responsible, it builds trust and deepens emotional connection. It's the foundation of a healthy sexual relationship. Always ask. Always respect. 3. Have the STI conversation. Yes, it can feel uncomfortable, but it's absolutely necessary. Before sex, talk about STIs, sexually transmitted infections, with your partner. When was the last time you were tested? Are you currently using any protection? Do you have any known infections or symptoms? These aren't just personal health questions, they're about protecting each other. Sharing test results builds trust and transparency. And if someone avoids the topic, that's a red flag. Regular STI screenings are part of being a responsible adult. Don't wait until it's too late. Even if you trust your partner, testing is a good habit. Prioritize your health, protect your future, and keep the conversation open, honest, and respectful. Sexual wellness includes your sexual safety. 4. Use protection. Always. Unless you and your partner are in a monogamous, tested relationship and trying to conceive, use protection every time. Condoms, both external and internal, are the only form of protection that helps prevent both STIs and pregnancy. Don't assume someone else has it covered. Take responsibility by keeping condoms, dental dams, or other barriers available. Also, make sure you know how to use them correctly. Improper use is a common cause of failure. Never feel embarrassed to bring up or use protection. It shows you're informed and responsible. And if your partner refuses protection, that's a major red flag. Safe sex is smart sex. Protect your health, protect your partner, and enjoy worry-free intimacy. 5. Clean yourself up. Hygiene matters, not just for you but for your partner too. Before sex, take a quick shower or at least freshen up your genitals, hands, and mouth. This helps prevent infections and makes things more comfortable and pleasant. Don't use harsh soaps or scented products on your private parts. Warm water or gentle cleansers are enough. If you're uncircumcised, clean under the foreskin properly. Oral hygiene is also crucial if there will be kissing or oral sex. Feeling clean can boost your confidence and show consideration for your partner. Hygiene isn't about judgment, it's about mutual respect. A few minutes of cleanliness can make a huge difference in the quality of your intimate moments. 6. Set the mood and boundaries. Before diving into the act, take a moment to talk about what you want and what you don't. Maybe you're comfortable with kissing but not ready for penetration. Maybe you're okay with oral but not with certain positions. Clear communication helps set healthy boundaries. You can also create a more relaxing, sensual mood. Dim lights, soft music, and a tidy environment can help ease anxiety. Don't rush. Take time to explore and connect. This isn't about being perfect. It's about being present. The best sexual experiences happen when both people feel safe and understood. So ask, share, and respect each other's limits. That's how pleasure and peace coexist. 7. Stay sober and mindful. Sex under the influence might seem exciting, but substances like alcohol and drugs can impair your judgment, motor skills, and ability to give or interpret consent. While some people think alcohol lowers inhibitions, it also lowers your ability to detect discomfort or danger. Staying sober means you're more present, aware, and in control of your choices. You can communicate clearly, enjoy intimacy more consciously, and avoid post-sex regret or confusion. If either of you is too intoxicated, it's not the right time. Be patient. Your well-being is more important than any moment of pleasure. Choose presence over pressure. Mindfulness and intimacy leads to better communication, stronger emotional bonds, and safer experiences for both partners. Bring lube just in case. Lube can make sex smoother, more comfortable, and a lot more enjoyable. Even if you're naturally lubricated, certain situations, like condoms or longer sessions, might need extra help. Using lube reduces friction, which can help prevent tearing, irritation, and pain. Choose a body-safe, water-based, or silicone-based lubricant. Avoid products with fragrances, sugars, or ingredients not meant for genital use. Keep it nearby so you don't interrupt the flow. Talking about using lube isn't awkward, it's smart. It shows you care about comfort and pleasure. So add it to your sexual toolkit, especially if you're trying something new or if either of you tends to get dry. When in doubt, lube it out. 10. Go to the bathroom before. It's a small step that makes a big difference. Emptying your bladder before sex reduces the chance of urinary tract infections, UTIs, especially for people with vulvas. It also prevents mid-activity bathroom interruptions and improves comfort. It doesn't have to kill the mood, just make it part of your pre-intimacy routine. If your partner needs a minute, be patient. Clean and clear is better than rushing into discomfort. Plus, a quick bathroom visit gives you a moment to freshen up, check in with yourself emotionally, and prepare mentally. A little physical and mental prep can elevate the whole experience. So take that bathroom break, your body will thank you. After sex, segments 11 to 20. 11. Pee after sex, especially for women. One of the most important things to do after sex? Pee. Especially for people with vulvas, urinating post-sex helps flush out bacteria from the urethra and reduces the risk of urinary tract infections, UTIs. UTIs are common but painful and easily preventable with this simple step. For men, it's less critical but still a good habit. You don't need to rush, just aim to urinate within 15 to 30 minutes after sex. If your partner needs a moment to use the restroom, give them privacy and time. This isn't about being clinical, it's about taking care of your body. Treat peeing after sex as part of your self-care routine. It's quick, easy, and can prevent a lot of discomfort later. 12. Clean up gently. After sex, your body might feel sticky, sweaty, or just out of sorts. That's totally normal. Take a few minutes to gently clean yourself. Use warm water and a soft cloth or gentle cleanser. No need for aggressive soaps or scrubbing. For women, avoid douching. It disrupts natural vaginal flora and increases infection risk. For men, cleaning under the foreskin, if uncircumcised, is important. Mouth rinsing is helpful after oral sex. A fresh towel or wet wipe can be convenient too. This isn't about shame, it's about comfort and hygiene. A simple post-sex cleanup routine keeps infections away and helps you feel refreshed. It also shows you respect your body and your partner's well-being. 13. Hydrate your body. Sex is physical activity, and like any workout, your body loses fluids through sweat, exertion, and breathing. After sex, rehydrate by drinking a glass of water. This helps flush out toxins, supports kidney function, and assists in preventing UTIs. Staying hydrated also keeps your energy levels up and can minimize any post-sex fatigue or cramping. If you've had a longer or more intense session, hydration is even more important. Want to be extra thoughtful? Offer your partner a glass of water too. It's a small, caring gesture that deepens emotional connection. Water may not be sexy, but staying hydrated is one of the easiest and healthiest things you can do after sex. 14. Talk about what you liked or didn't. After sex is a great time to share feedback. Gently, honestly, and kindly. Was something really enjoyable? Let your partner know. Did something feel awkward or uncomfortable? You can bring it up respectfully. This doesn't have to be a serious or heavy conversation. It can be flirty, fun, and connective. Saying things like, "I loved it when you," or "next time could we try," helps you both grow sexually and emotionally. It also builds trust and makes future encounters better. Avoid criticism or blame. Focus on sharing feelings and preferences. Open communication after sex creates intimacy, reduces misunderstandings, and shows that both partners are willing to learn and improve together. 15. Be emotionally present. Some people feel vulnerable, euphoric, or even sad after sex, and that's normal. It's called post-coital dysphoria, and it happens due to hormonal shifts and emotional release. If your partner seems quiet, withdrawn, or emotional, don't panic. Offer gentle reassurance. A cuddle, a kind word, or simply being there can make a huge difference. This is also the time to check in. How are you feeling? Or, was that okay for you? These small questions show emotional maturity and care. Sex isn't just physical, it's an emotional experience. Being present after the act deepens intimacy and turns a physical moment into a meaningful connection. Stay open, attentive, and kind. The afterglow matters too. 16. Cuddle or share intimacy. Cuddling after sex isn't just cute, it's powerful. Physical affection post-sex releases oxytocin, the bonding hormone, which promotes closeness, trust, and emotional safety. Cuddling, holding hands, or simply laying close together helps you both transition from the intensity of sex to a relaxed, safe state. This doesn't mean you have to engage in deep conversation. Even quiet, nonverbal connection strengthens emotional intimacy. Not a cuddler? Try a soft touch, kiss, or back rub. If you're with a new partner or in a casual dynamic, discuss boundaries, but don't underestimate how post-sex closeness can enhance connection. Physical affection is a love language, and after sex, it speaks volumes. 17. Check for pain or discomfort. After sex, it's important to check in with your body. Was anything uncomfortable, painful, or irritating? Mild soreness or sensitivity can be normal, especially after long or intense sessions, but persistent pain isn't. For women, pain during or after sex could be due to dryness, lack of arousal, infections, or underlying health issues. For men, pain might result from friction, lack of lubrication, or even minor injuries. If something doesn't feel right, don't ignore it. Monitor how your body reacts over the next few hours or days. Seek medical advice if symptoms worsen. Your sexual health deserves attention and respect. Pain is your body's way of saying something's off. Listen and take action. 18. Store protection and toys properly. After the fun, take care of your tools. Dispose of used condoms properly, tie them off and toss them in the trash, not the toilet. If you've used sex toys, clean them according to their material, usually warm water and unscented soap or a toy-specific cleaner. Let them dry before storing. Rechargeables? Plug them in. This keeps your toys hygienic, long-lasting, and ready for next time. Keep everything in a clean, dry place. Store lubricants with lids tightly closed to prevent spills. Post-sex cleanup may not be glamorous, but it's essential for health and safety. Treat your sexual health gear like any other personal care tool, with cleanliness and care. 19. Reflect and respect each other's space. After sex, you might want to cuddle all night, or you might want space to decompress. Both are valid. The key is to communicate what you need without guilt. Some people feel emotionally full and want to sleep. Others might need to reflect or get back to their day. If you're with a regular partner, make space for both closeness and independence. If it was a one-time or casual encounter, be respectful and kind when parting ways. Saying something like, "Thank you, I had a great time," or "Let me know when you get home safe," leaves things on a good note. Whether staying or leaving, always show respect and empathy afterward. 20. Schedule an STI check if needed. If you've had unprotected sex or something unexpected happened, like a condom breaking, schedule an STI screening as soon as possible. Some infections don't show symptoms right away, so even if you feel fine, it's smart to get checked. Early detection means early treatment and less risk of complications. Many clinics offer confidential testing, and it's often fast and free. If your partner disclosed an STI status after the fact, don't panic. Educate yourself, consult a professional, and stay calm. Testing isn't about shame, it's about responsibility and health. Make it a routine part of your sexual wellness, just like brushing your teeth or exercising. Conclusion. Sex can be one of life's most beautiful, exciting, and fulfilling experiences, but only when approached with care, consent, and communication. What you do before and after sex directly affects your health, your emotional well-being, and your relationships. By checking in with yourself, practicing good hygiene, using protection, and showing empathy, you turn sex into something more than physical. You create a safe, respectful, and meaningful connection. Whether you're new to intimacy or experienced, always choose knowledge over assumption and care over convenience. Your body is sacred. Treat it and your partners with the love and respect they deserve. Thanks for watching. If you found this helpful, don't forget to like, subscribe, and share it with someone who needs this info. Drop your thoughts or questions in the comments. We're all learning together. Until next time, stay safe and informed.